Okay, let's talk about TRT for men and why I believe it is an absolute game changer and almost like the fountain of youth for guys in their 40s, 50s, sometimes in their 30s, to be able to give them the lease of life back that they had in their 20s. And the first, I want to caveat this with I'm not a doctor, I'm not a hormone replacement therapist, but this is based off of years of my own experience of working with guys that have gone from low testosterone levels to optimal testosterone levels. And I think the foundation really, before we start, is to understand what TRT is. Testosterone replacement therapy is giving your body the testosterone it needs to bring it back into a normal range. And a normal range it differs depending on the lab that you test through. But let's keep it broad. The amount of testosterone you had in your 20s, when energy levels were high, when you could do literally anything and rebound from it the next day, and you had this almost like this unlimited energy pool. And a lot of guys, they get older, they lose that, and largely that's down to testosterone declining. So if you think about what testosterone does, back 20 years, people said that if you went on TRT, there was this trade, right? Which is, again, replacing your testosterone that you had in your 20s. There was this trade-off. Okay, cool, you could go on TRT, you'll feel better, but you'll shave 5 years off of your life. And their way of viewing it was, okay, it might shave 5 years off because you put yourself at high risk of things like prostate cancer, but you'll live a better quality of life. So is that a trade that you want to make? Now, as time's gone on, they've reversed that narrative, and more studies are coming out saying that TRT actually lengthens the lifespan for guys. Because, sure, if you are prone to prostate cancer, having a higher level of DHT puts you at higher risk of that. But again, you can monitor that through getting blood work done regularly, which everybody should be getting done. If your prostate markers are high, you need to go and regularly get that checked up. If on TRT you see that marker going high, then obviously you adjust accordingly. But thinking about what testosterone does for men. Testosterone gives us confidence. It gives us energy. It allows us to be able to recover from things better, and it allows us to move more, which ultimately, because we are doing those things by having optimal testosterone levels, being more active, it allows for better muscle retention. It allows for better motivation to eat well, regularly train, because you're not recovering for 3 days afterwards. And the byproducts of us having normal testosterone levels allow us to be able to live longer because we're moving more. And it's largely a use it or lose it situation in most cases, where most people, and we've heard this before, people say, oh, I'm old now. And quite quickly they decline because they've just acknowledged they're old, and therefore they move less. They choose not to do things because they believe that it's not for old people. And because of that, they wither away. When in reality, that doesn't have to be the case. With TRT, and if you get a blood test done, and this is how you should know whether you should be on TRT, get a testosterone blood test done. Now, I'm from the UK. You can go and buy one of those at Tesco now. They're that easy to do. You can buy one for £35 at Tesco. It's a finger prick blood test. Send off your test, get your results back. If your blood test comes back low, then what you would do is go to a doctor or a hormone replacement therapist, and then they would give you a dosage to start on of, I say artificial testosterone, but medication. You can choose injections. There are gels. There are even pills, I believe. But the goal is to bring our testosterone back into line. Now, as a byproduct of that, you are going to feel more manly, you're going to have more energy, and so on and so forth, like I've already mentioned. And the benefits of that are massive. Massive. Because I've seen guys, and I've worked with guys that have gone from going to work with literally no energy to going to work and doing 3 times the output because they just have a better sense of, I want to do this. So hugely beneficial. Now, I'll caveat that with, you need to make sure that you're getting regular blood testing done. If this is something you are going down the route of, you need to make sure you get regular blood testing done. Because, again, largely things like prostate cancer will come from an unmonitored level of prostate markers. So it's not to say that as soon as your prostate markers go high, we suddenly get prostate cancer. They're high. How long are you going to keep them high? And eventually, because they're high for long enough, we now have lots of issues. So if you can track onto it quick, you can use things to allow you to stay on testosterone, but lower down the DHT side, the dihydrotestosterone, that will impact your prostate markers such as finasteride, dutasteride, and so on and so forth. And whilst it won't completely block the conversion of DHT, it will lower it down. It will, absolutely. That's why there is this group of people online that believe that if you're on finasteride and you're taking testosterone, finasteride will do nothing. There are so many guys I know that had hair loss starting to happen before they were even taking testosterone. And then they went on TRT and started taking finasteride and their hair regrew. It stopped receding. So if it was a case that they were taking testosterone and it was exacerbating their hair loss, they would have just accelerated their hair loss that was what they were already experiencing before TRT. It didn't do that. It did the reverse. So there would have to be less DHT if DHT is the thing that binds to the scalp that ultimately causes the hair follicle to miniaturize and fall out. There'll be less DHT to allow the hair to grow effectively. So what I'm trying to say with this video is TRT is not something you should be afraid of. It is something that is a tool to use to be able to allow you to enjoy life. And as a byproduct of you enjoying life, all the side effects of you enjoying life will allow you to inherently live longer. Not only will it benefit you with longevity, energy levels, etc., it will also benefit you in the gym. You will gain more muscle because testosterone is the primary driver of muscle. I would say muscle growth. It's not, but it helps facilitate muscle growth, which is why when bodybuilders use androgens, we elevate our testosterone up. So it will allow you to put on more muscle. It will allow you to keep a better body composition, which in turn will lower your blood pressure, keep your blood sugar levels in line, and so on and so forth. The benefits are massive. So don't be afraid of it. It is not something that we should demonize. It is something that we should talk about more. And I truly believe that a lot of guys would be in their 40s and feel like they're in their, or 50s and feel like they're in their 20s and just feel like completely different people than what they do now. Because if you're in your 40s and your 50s, you feel depressed, you feel lethargic, you don't feel like you never get back to the way you were in your 20s. You can, you just have to find the markers that are out of line and replace them. And generally that comes from testosterone. And testosterone only decreases as we get older because your body doesn't really feel like it needs to reproduce because it assumes you've already done that by now. So, TRT, if you are considering it, if you feel like you have low testosterone levels, get your bloods done, figure out where your testosterone's at, and then address it by speaking to a doctor or a HRT specialist.